Welcome to the Canadian Rhinosinusitis Best Practices and Standards Working Group website, which features the recently published guidelines, Canadian Clinical Practice Guidelines for Acute and Chronic Rhinosinusitis. The guidelines were developed in collaboration with the Canadian Society of Otolaryngology Head and Neck Surgery, the Association of Medical Microbiology and Infectious Disease Canada, the Canadian Association of Emergency Physicians, the Canadian Society of Allergy and Clinical Immunology, and the Family Physicians Airway Group of Canada. The guidelines were developed to answer many outstanding questions and ongoing controversies on the management and treatment of rhinosinusitis. Through the efforts of the group, we were able to look more closely at chronic rhinosinusitis and for the first time ever develop a consensus on the diagnosis, management, and treatment of this emerging condition. The guidelines are intended to provide guidance on these and other clinical questions about acute and chronic rhinosinusitis in adults. For example, is it a cold, allergy, or sinusitis? How is a patient with acute or chronic sinusitis identified? What is the appropriate investigation of the patient with suspected acute or chronic sinusitis? Are antibiotics required for the management of all cases of acute bacterial sinusitis? When should a patient with suspected acute or chronic rhinosinusitis be referred? How are complications detected in a patient with sinusitis? What is the optimal management of rhinosinusitis? What are the evidence-based recommendations for appropriate selection of non-medical and medical therapies for the management of acute and chronic sinusitis? How are patients with chronic sinusitis managed over the long term? The goal of the guidelines is to present information in a relevant, understandable, and easy-to-read format that highlights pertinent information to you who offer first-line care for patients with ARS or CRS. Each section of the guidelines has relevant take-home points, neatly summarized for your easy reference. Take a look and download the step-by-step algorithms and newly introduced mnemonics differentiating CRS from ARS, or CPODs from PODs. Learn when to urgently refer patients to a specialist or when to order a CT scan. Understand the possible alternative diagnoses or simply review the suggestions for alternate therapy or withholding antibiotics. We hope you take the time to review the many available tools on this website. Come back often, as we'll be adding additional tools on an ongoing basis. I hope you enjoy your visit to the website.